Hi, this is John Kanellopoulos here in our office. I want to share a very interesting case with you today. We're in Athens, Greece at the Laser Vision Ambulatory Surgery Center. This is a 62-year-old gentleman who is visiting us today. He's pseudophakic with very high myopia to begin with. We're seeing here two very nicely placed posterior chamber intraocular lenses. He has coinciding diagnoses of glaucoma, and he's currently using Ganford, a combination of prostaglandin and beta blocker at night, and Cibreza, which is a combination of carbonic anhydrase inhibitor and an alpha agonist, morning and night, and this is creating a little bit of hyperemia, but he's non-symptomatic. The reason that probably his treatment is being boosted with target under 13. His pressures with his regimen are 11 in both eyes, and his corneal pachymetry is 550. So his pressures are around 11, 12 adjusted. So the reason the treatment is boosted and target is lowered to low teens is because of the imaging of the optic nerve, which we know has essentially replaced the visual fields. And we see that this does look glaucomatous. This is the right eye. And if we see the similar images on ganglion cell layer, we can see a significant loss on the right eye, depicting potentially glaucomatous damage. But we cannot ignore the fact that this patient was a very, very high myopia. You can see here the scarring from an old Fuchs spot, and this can give similar picture to the glaucomatous damage. Here are the relevant pictures from the left eye. Again, this does resemble glaucomatous damage, but looking at the OCT, this is mainly a Fuchs spot, meaning a hemorrhage from pathologic myopia that has stabilized. His visual acuities are 20/70 in the right eye and 20/100 in the left eye. And it is only, we by the way have pachymetries 550 here with the Avanti anterior segment OCT. We mainly do this for epithelial measurements as well, 554, as I mentioned, the left eye. But the key thing here is his funduscopy that shows, and these are the dramatic wide field images with the Optic. They show the remnant of the Fuchs spot in the right eye, and at the same time, a very, very healthy optic nerve. We see here that the optic nerve is very healthy. It's pink, it's a little tilted temporally. So clinical judgment here surpasses the glaucomatous sensitive interpretation of the OCT. And the OCT is poor due to the macular damage and not the glaucomatous damage. And I think that this case brings up, underlines a very important point on how a clinician can separate the two. These are the similar images from the left eye. Again, the significant macular scar, a Fuchs spot from myopic degeneration on the left eye, and a relatively healthy optic nerve. So in my opinion, the IOP target here would be 20 and not 11. And I would, without hesitation, switch the patient to just Ganford at night. I would allow him to have pressures in the high teens, as he does without the Cibreza, if he develops allergic symptoms with the Cibreza. I have a better detail here with the anterior segment OCT. We have the angiography showing the significant damage to the macula from the old Fuchs spot. The macular center here in the right eye is almost devoid of capillaries, and similar picture here in the left eye. And again, nothing tells a story better than a good fundus exam and evaluation of the optic nerve. I wanted to close again with the hyperemia that we can see here. This is his right eye from the alpha agonism that the Cibreza contains. And if this becomes symptomatic, I would comfortably switch this patient to not using it and using only the Ganford. So I hope you found this case interesting. This is a case where our OCT-ONH data that may suggest progressive glaucomatous damage need to be interpreted parallel to the macular damage from the pathologic myopia that this patient had before. Obviously, we can't offer him treatment-wise something better than low vision aids at the time. His cataract surgery is very good. He doesn't improve with correction. And this is John Kanellopoulos signing out from Athens. Thank you very much for your attention.